Hi, I am Dr. Sunil Udgire. I am a consultant hematologist, pediatric hemato-oncologist and bone marrow transplant physician working at SPARSH Hospital, Yeshwanthpur, Bangalore. Today I am speaking about beta thalassemia major. So beta thalassemia major is inherited genetic disorder where there is a abnormal hemoglobin formation that lead to anemia. So usually children with thalassemia major, they usually present at age of 6 months with the symptoms of anemia requiring blood transfusion. So for the normal development and growth, they require usually regular blood transfusion every month to keep their hemoglobin between 9 to 10. So this disorder mainly diagnosed with simple blood test called as hemoglobin electrophoresis, and if some patient who has received blood transfusion, then we can't diagnose with this hemoglobin electrophoresis. So we need to do a molecular genetic test for the confirmation of diagnosis. So why this thalassemia major happens to the children? So mainly when both the parents are thalassemia carrier, there are 25% chance of thalassemia major in each pregnancy. So the treatment, we need to give this regular blood transfusion every month to keep their hemoglobin between 9 to 10, and as we give regular transfusion, there is an increased iron overload in the body, and that mainly damages the liver, heart. So that is the reason we need to control these iron levels by giving some injections like desferoxamine, and there are tablets available like deferricerox, and that is how they can lead a normal life. But this transfusion has to continue lifelong, and we have to maintain this pre-transfusion hemoglobin at required level. Is there any permanent solution? Yes, there is a permanent solution available for this dreaded disease, that is mainly the allogenic bone marrow transplantation. So usually we do a HLA typing for the patient and the siblings, and if we have a matched sibling donor available in the family, then we can do this allogenic bone marrow transplantation. And if there is no matched family donor which is available in the family, then we can go ahead and search is there any unrelated donor available, then we can do unrelated donor transplant. So with this matched sibling donor or unrelated donor transplant, we can cure this disease with 90% cure rate. Ideal age for the transplantation is between 2 to 7 years. We can do up to 10 years or even 15 years if the patient is well chelated and their iron levels are within control. And there are now newer therapies like even haploidentical transplantation. Usually the donor is not an issue because in the family we will get at least 50% matched donor, and we can do this T-cell depleted haplotransplant with good success rate. There are experimental therapies, mainly now newer therapies are coming up like gene therapy. If this gene therapy becomes available, then definitely it is a boon for these children, and everyone will get cured with this gene therapy, even if you don't have any donor available for transplantation. Can we prevent this thalassemia? Yes. So you can just do this hemoglobin electrophoresis. You can find out your thalassemia carrier status. If both the partners are having thalassemia carrier, then they can avoid the marriage, or even if they can marry, they can check their, once the pregnancy is detected, they can check their fetus whether it is a normal carrier or major, and if that fetus is having thalassemia major, they can abort that fetus. So I think with the coming up with this bone marrow transplantation, newer technique and gene therapy, I think it is a boon for these thalassemia children to get cured.